Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we'll be talking about what is the difference between subluxation and concussion. These type of injuries that are seen in the primary teeth, which is equal to children's teeth, we will talk about in details. So make sure to watch the video until the end. Let's start with what is concussion. Concussion is an injury to the tooth supporting structure, which is to the tooth in general. Without displacement, the tooth will remain in its place, or loosening, which means that the tooth is not mobile, but the tooth will be tender to percussion, which means that when you tap on the tooth via the mirror, the patient will tell you that I'm feeling pain. The tooth will be tender to percussion. Now we will see a clinical presentation for a patient having a concussion. So how you can know whether this is a concussion or no, just by doing the diagnosis for the patient, tapping on the tooth if it is tender to percussion, both vertical and lateral tender to percussion, which means that the patient is having concussion. And you can ask him if there's any history of trauma, because one of the causes is trauma. So here are the diagnosis. As I said, if the tooth is tender to percussion, both laterally and vertically, it can confirm that the patient is having concussion. What is the treatment? Make sure to watch the video until the end so that you will know what is the treatment for concussion. And regarding the sensibility test, or the vitality test, it will be positive. Which means that the tooth is still vital. It's vital and it is only tender to percussion, and there is no mobility and there's no displacement of the tooth regarding concussion. But what about the other one, which is subluxation? Subluxation is injury to the tooth supporting structures with loosening, which means that the tooth is mobile, but with no displacement, which means that the tooth is in a place, but it is mobile. You can move it like buccally, palatally, like that. So it is mobile via the mirror. You can check the mobility, or you can see my previous videos regarding the mobility, how you can check mobility. Now, the same clinical presentation picture I used for the concussion, similar to the subluxation, because both of these are the same thing. How you can differentiate only by diagnosis, doing diagnosis on the tooth, checking if the tooth is tender to percussion, both vertically and laterally, and there is no mobility, which means that it is concussion immediately. But if it is tender to percussion plus it is mobile, it's not displaced, it is mobile only, this is subluxation. This is how you can differentiate between subluxation and concussion as well. As you can see in the picture, tender to percussion and tooth is mobile in horizontal direction. It can confirm the diagnosis for subluxation. And regarding the mobility, I already said before in my videos that you can check the mobility via the two mirrors, placing the blunt end of two mirrors and check if the patient is having grade 1 or grade 2 or grade 3 mobility. Of course, if the patient is having grade 3 mobility, it will be poor prognosis, so the treatment will be extraction, in comparison if the patient is having grade 1 or grade 2, which is with questionable prognosis. But regarding grade 1 mobility, I will tell you the treatment at the end. Now, what about the radiographical changes for both the subluxation and the concussion? There's no any X-ray changes. So if you take an X-ray, it cannot confirm for us if the patient is having concussion or subluxation. So only, as I said before, by the diagnosis, doing diagnosis via if the tooth is tender to percussion, if the tooth is mobile, okay, you can confirm your diagnosis only. But on the X-ray, you cannot see any changes. Maybe there will be widening of the PDL space, but it will not confirm for us anything, whether it is concussion or subluxation. Also, in addition to the diagnosis, you need to ask the patient about any history of trauma to the tooth. Why are you complaining of this tooth now? So we said now the cause behind it is trauma to the teeth, because like you know that in the children, the children are very hyperactive. They play football, they bicycle, jogging, and many other things. So they might fall on their face, and when they fall on their face, these injuries might be seen, which is concussion or subluxation. We have also not only these injuries, we have more injuries that can be seen in the primary dentition. But I'm today only I will focus on these two, subluxation and concussion. So always remember to ask the patient about any history of trauma to the teeth. Now, what is the treatment now? Now, regarding the treatment, we need to provide relief of the occlusal interference by selective grinding of the posterior teeth. So we said that now here the injury is in the anterior. So we have pressure on the anterior. So we need to relieve the posterior in order for the anterior so that there will be no pressure on the anterior teeth. So remove if there is any relief of occlusal interference by selective grinding of the posterior teeth in order to provide relief for the anteriors at the end, or for the tooth itself that is suspected of concussion or subluxation. Now, if we said that for concussion, no need for splinting because the tooth is not, there's no loosening, there's no displacement. But for the subluxation, because we said that the tooth is mobile, so we need to do splinting. And I will show you a picture now how the splinting is done. Now, as you can see in the picture, this is a splinted. This is a wire. We will place a wire on the teeth, and then apply GIC and then light cure. So this one, if the patient is having a severe loosening, so he's having like a grade 2 mobility, so we need to do splinting so that the tooth will not move, because if it moves and you did not do splinting, it can break easily. And if it break easily, maybe still the permanent teeth did not erupt yet. So very important to do splinting, as well as because throughout the splinting, we need to ask the patient to eat a soft diet for 14 days at least, for 14 days, so that the tooth will not break. We don't want the tooth break if the patient ate an apple, ate strong food. Okay, avoid any hard food for at least 14 days. That's it. I am done. Thanks all for watching. If you have any questions, make sure to write it down in the comment section below, and I will be more than delighted to answer your questions. And please don't forget to like, comment, and subscribe for more and more videos.